If you're considering an ADHD medication for your child, you need to know how stimulants, methylphenidate or amphetamine and non-stimulants work, whether risks exist, and what dosages and frequencies are normal. Here, experts answer these and other frequently asked questions about treating your kid's ADD. ADHD medications for children, are they necessary? Is my child too young for ADHD medication? Children as young as 4 can be diagnosed with ADHD, according to the American Academy of Pediatrics, AAP. The AAP recommends behavior parent training as the first-line treatment for preschool-aged children, children younger than 6, with ADHD. Clinicians. The AAP adds, may consider prescribing methylphenidate to a preschool-aged child with ADHD if symptoms do not improve for children 6 and older. The AAP recommends ADHD medication along with behavior parent training. Karnisky and other experts agree that parents should consider ADHD medications when symptoms interfere with their child's social, emotional, or academic life. If your child has been diagnosed with ADHD and is struggling, he probably needs medication, says Stephen Copps, MD, an ADHD specialist in Macon, Georgia. Medication is the cornerstone of therapy. It is not a last resort. Delaying medication, according to Karnisky, could result in unintended long-term consequences. ADHD medications for children, are they safe? While some clinicians have had concerns about the impact of stimulants on cardiovascular health, recent research published in JAMA Network Open 1 has revealed the concern is unsubstantiated. It found that ADHD medications did not increase the risk of cardiovascular events among children and teens, or adults of any age. What are the side effects associated with ADHD medications for children? Stimulants can cause a range of side effects, notably appetite suppression and weight loss. But these effects tend to be transient, recent studies suggest. This side effect usually goes away on its own within 6 months, Copps says. Giving children a big meal after their medication has worn off may be enough to compensate. In rare cases, children taking a stimulant experience visual or tactile illusions. Larry Silver, MD, clinical professor of psychiatry. After all, the problem can usually be solved with a simple adjustment to the medication's dosage or schedule. I've heard that some parents allow their children to go off medication at times, for example, during weekends or over the summer. Are drug holidays a good idea? Some experts, including Copps, are dubious of this practice. 1/3 to half of your child's education occurs outside of school, he says. If he can't pay attention, he can't learn. Silver says parents often tell him that their child does not need meds at home because they can handle these behaviors there. In response, he says, I ask if they spend time telling them to sit still, leave your sister alone, and stop interrupting me. If the answer is yes, I tell them, you may be living with these behaviors, but you're not tolerating them. Think about what you're doing to your child's self-esteem. On the other hand, children who have used a stimulant successfully for some time might be given a brief trial off the drug, to see if it is still necessary. This should be done only when school is out and only with a doctor's supervision.